Hello, my dear friends. I'm Dr. Vaishali Bharambe. I'm an MBBS, MD, PhD in anatomy. This series is about brainstem. I will be taking you through the introduction to brainstem, parts of brainstem, location of brainstem, connections of brainstem, blood supply of brainstem, and lesions of brainstem. It's a long journey. I hope you enjoy it as much as I do. So let's begin by understanding the gross description of brainstem and its blood supply. First question, why are these taught together in the same lecture series? They are taught together in the introduction because brainstem receives its nutrition through the blood supply. And it is the blood vessel lesions that actually result in the tragic lesions of brainstem. Let's ponder upon some questions now. Question 1, what is brainstem? Question 2, where is brainstem? Question 3, what are the parts of brainstem? And question 4, what does brainstem do? Good questions? Yes? So let's begin to answer them. What is brainstem? Now here in this image, you are able to see the brain here, the spinal cord here. So there is a tiny little part which exists there between your brain and the spinal cord, which is brainstem. So brainstem is a part which connects your brain to the spinal cord. We will understand this better in this image now. See, this image is actually a midline section through your brain, okay? So it is located at the junction between the brain and the spinal cord. So here is your brain, here is your brainstem, and here is your spinal cord. It sits in the posterior part of the brain, beneath the cerebrum, posteriorly related to the cerebellum. Take a look at it again. It's posteriorly related to the cerebellum. So, brain above, spinal cord below, brainstem, posteriorly related to the cerebellum. What are the parts of brainstem? So, again take a look. Orient yourself at all times. This is the brain, this is the spinal cord. Here is your brainstem, which is made up of 3 parts. What are the 3 parts? Medulla oblongata, pons, and midbrain. From below upwards, if you can say it with me, medulla oblongata, pons, and midbrain. Okay? So now we've established what is brainstem. We've established parts of brainstem. Okay? What does the brainstem do? Why is it so relevant that an entire lecture series is devoted to it? So this is very crucial slide. Pay attention. You may not understand the functioning, but at least you will know the functions. At the end of brainstem, you will understand the functions as well. So first, it controls motor functions. So remember, it connects your brain to the spinal cord. So any tracks that go from your brain to the spinal cord have to pass through the brainstem. So, it directs movements by managing signals from your brain to your muscles, thus controlling your motor activities including posture and balance. Now, same thing can be done the other way around. Sensations from your body are carried by tracks through your brainstem to your brain. Therefore, it makes you aware of every sensation you are experiencing. It is also the seat of centers which control your heart rate, your breathing, your blood pressure. And it regulates your consciousness. How, where, we will understand this later. But motor activity, sensations, heart rate, and consciousness, almost every important function of your body is in the brainstem. So, how does it do all this? It does all this, and that's what this series is all about. It's about understanding how does the brainstem do all this. Okay. Now, let's understand the gross anatomy by zooming in. Now, you will find that my images are very simplistic. There is a reason why they are simplistic. Because I cannot give you complicated images and confuse you. Look at these simple images and slowly, even you can pause the video and draw them. All my images are images that you can and should be drawing. Okay. So take a look at this. This is the anterior view of the brainstem. Okay. So the extent of the brainstem, inferiorly the brainstem is related to an imaginary plane that is passing through the upper border of atlas vertebra. So I'll show you the atlas vertebra now. See, this is your atlas vertebra. Okay, that's the C1 vertebra. All right. So if you were to draw a plane passing through the upper border of the posterior arch of atlas, that is the lowermost limit of your brainstem. Now I have drawn another line on the screen. This is a line drawn at the junction of the pons and the medulla oblongata. This structure between this plane and this line is your medulla oblongata. Draw another line at the upper end of pons, and here these two are your cerebral peduncles. You can say this once. They are called cerebral peduncles. Rope-like tracks which are connecting your brain downwards. These are cerebral peduncles. At the junction between the pons and the cerebral peduncle, you have pons. Okay, and then this part above is midbrain. So from a transverse plane that is passing through the upper border of C1 vertebra to the junction between pons and medulla oblongata is the medulla. Between this line and this line is your pons, and above this line is your midbrain. Now here you're seeing a midline section. Okay, so these two structures here are called as superior colliculi, and superior and inferior colliculi are posterior representation of the midbrain. So whenever you're looking at midbrain, you see two colliculi posteriorly, cerebral peduncles anteriorly. So this should be the cerebral peduncle, and these two should be the superior and inferior colliculi. And therefore, a line above the superior colliculus is the upper limit of your brainstem. Got it? Upper limit of your brainstem. So this is your midbrain, this is your pons, and this is your medulla oblongata. Here is your cerebellum, and the pons and medulla and cerebellum are separated from each other by a cavity. Let me remove it to bring your attention to it. Can you see that there is a cavity between the pons and medulla oblongata? That's your cerebellum. That's the cavity I'm talking about, called as the fourth ventricle. So let's revise this quickly. Superiorly midbrain, pons, medulla. Posteriorly cerebellum. Separated from each other by a cavity called as the fourth ventricle. Okay. In midbrain, we just learned that midbrain posteriorly shows two swellings, which are two pairs of swellings, which are called as superior colliculi and inferior colliculi respectively. Right. Now we've turned the brainstem some more and we are looking at its posterior aspect, posterior view of brainstem. Take a look. Now here is again our favorite plane which is passing through the upper border of posterior arch of atlas or C1 vertebra. This is the line drawn through the junction of pons and medulla oblongata. Therefore, this is medulla. This is pons. These are the two inferior colliculi. These are the two superior colliculi. Therefore, what is this? Midbrain. Right. And now, if you draw a line through the lower border of the inferior colliculi, these two lines delineate your pons. Okay. So, medulla, pons, and finally, this is your midbrain. This is the view you will get posteriorly. And what is this? Yes, this diamond-shaped structure is the floor of fourth ventricle. Now, I want you to ponder upon, look at this image and tell me what has been removed so that you could look at this. What has been cut? You can see the cut sections clearly. This is cut, this is cut. What has been cut? So, what has been cut and removed is your cerebellum. If the cerebellum was in place, you would not be able to see the posterior surface of brainstem. When you remove cerebellum, then you look at the floor of fourth ventricle. And these cut sections that you are seeing are called cerebellar peduncles. which connect the brainstem to your cerebellum. I won't talk about them. You will learn a lot about them in this lecture series. All right. So what have we done up till now? That's the floor of fourth ventricle. Let's quickly recapitulate what we have learnt. Right. So this is the anterior view. That's the posterior view of brainstem. This is the medulla oblongata. That's the pons. And that diamond-shaped structure is the fourth ventricle. These are two cerebral peduncles. These are superior and inferior colliculi. And this is your brain, midbrain. I hope you've got all this. This is your medulla, pons, midbrain, superior inferior colliculi, cerebellum, and the fourth ventricle. See, why am I revising this? Because that's how brain is learnt. Brain is studied by repeat revisions. I have always told my students that that person understands brain who knows how to go back. It's a very awkward statement because we usually like to go forwards in our books, isn't it? But only that student learns neuroanatomy well who has the guts to go back. Just keep going back in your book to those words which you know you knew, but you don't really remember the details. Just keep going back, revising, and then moving forward. So 2 steps forward, 1 step back. 2 steps forward, 1 step back. That's how neuroanatomy is learned. That's my belief. I hope it will work for you as well as it has worked for me. Right. So I'm introduced to you the concept of fourth ventricle. So now I want to bring your attention to canals which contain CSF. I'm sure all of you are aware of CSF or cerebrospinal fluid. So understand that your entire brain and spinal cord, all these structures contain inside them cavities which contain CSF. Of course, they are all floating in CSF as well, but they are also containing a cavity inside which contains CSF. So let's take a look at the cavity we are familiar with, which is the fourth ventricle, which is the cavity between pons and medulla anteriorly and the cerebellum posteriorly. Look here, pons and medulla anteriorly and the cerebellum posteriorly. This fourth ventricular cavity continues above into the midbrain as aqueduct of Sylvius. So what is the cavity or the canal in the midbrain called? It's called as aqueduct of Sylvius. This then continues upwards into the brain, forming a dilatation called the third ventricle, which then continues, similarly the fourth ventricle continues downwards into the spinal cord as the central canal of spinal cord. If you're finding this too much, just allow me to continue with the class. When we come to revision, you will find yourself easily understanding this. There's nothing difficult about it. Right. So look at this brain again. That's the central canal of spinal cord. It rises upwards through the fourth ventricle. That's the central canal. It has entered upwards into the fourth ventricle, which continues upwards into the midbrain as aqueduct of Sylvius, which then continues upwards as the third ventricle, which then passes through 2 foramina of Monro to become continuous with lateral ventricles, which are cavities in each of your cerebral hemispheres. Got it? So let's do this one last time. Central canal of spinal cord rises upwards, dilates out in the medulla and pons as fourth ventricle. This then narrows and continues into midbrain as aqueduct of Sylvius, which then again dilates to form third ventricle, which finally passes through 2 foramina to become continuous with cavities in each cerebral hemisphere called the lateral ventricle. So let's come back to some basics. Brainstem is made up of 3 parts: medulla oblongata, pons, and midbrain. I often don't write the oblongata part because we are now into neuroanatomy. Usually we refer to medulla oblongata as just the medulla. Okay? Right. But we have something called hindbrain. Now what is this? What is brainstem? What is hindbrain? Pons, medulla oblongata and cerebellum together form hindbrain. Midbrain, pons and medulla oblongata together form brainstem. So I have a question for you. What is the cavity of hindbrain called? What is the cavity of hindbrain called? Of course, it's called as the fourth ventricle. Then what is the cavity of midbrain called? It's called as the aqueduct of Sylvius. If you've understood this portion, then these two questions should have come naturally. Right. So now we've got broadly the parts of brainstem. We've understood the cavity of brainstem. What's next? What is next is cranial nerve attachments. I think it's better that you see it than I talk about it. You're seeing the brainstem here. Understand that out of all the 12 cranial nerves that you have, except 1 and 2, all other cranial nerves are attached to brainstem. How? Take a look. This is cranial nerve number 3 and 4. Cranial nerve number 3 and 4 are attached to midbrain. They are attached to midbrain. I'll talk about details with individual parts. Now, 5, 6, 7, 8. 5 is attached on the surface of pons. 6, 7, 8 are attached at pontomedullary junction. Okay. As you come further down, 9, 10, 11, 12. All are attached to the medulla oblongata. Okay. So, 3rd, 4th, midbrain. 5, 6, 7, 8, pons. 9, 10, 11, 12, medulla oblongata. You will find that some of the nuclei are found both in pons and medulla, or sometimes even found both in midbrain and pons and so on. But how many cranial nerves are attached to brainstem? Except 1 and 2, all are attached to brainstem. Most of them are visible ventrally or anteriorly. Okay, trochlear is one nerve or cranial nerve number 4, which is originating posteriorly and winding forward. This is an anatomy which is very great fun to understand, but we will discuss it when we go to brainstem. The bottom line is all cranial nerves except 1 and 2 take origin from brainstem. Now let's talk about blood supply of brainstem. Before that, I want you to pause, drink some coffee or whatever else gives you happiness. But neuroanatomy needs to be digested slowly. Don't try and cram it up. It's not something that should be crammed. It is something that should be understood and, from my point of view, enjoyed. Right. So if you're rested, let's begin with blood supply of brainstem. It'll be fine if some of you can pause the video, take a notebook, write some notes. So which artery is this? As you can see, this is the vertebral artery. This is the C1 vertebra. The vertebral artery is a branch of first part of subclavian artery. Given off in the neck, it begins to ascend upwards. As it ascends upwards, you can see it passing through foramina transverse area, through C1, till finally the two vertebral arteries unite to form the basilar artery at the level of Pons. Okay. As it's forming basilar artery, it's giving rise to two branches which unite to form anterior spinal artery. Those of you who have done the spinal cord are aware that anterior spinal artery is a major blood supply to the anterior part of the spinal cord. So here now we are looking at the cerebrum or the brain from below. Okay. So just imagine this is the brain and you're looking at it from below. Okay. So what do you see? You're seeing again the vertebral artery and here is your internal carotid artery. These are two arteries that supply your entire brain. Vertebral artery, internal carotid artery. Now you can see your vertebral artery uniting to form the basilar artery. At the level of medulla, you can see how it gives rise to two branches which unite to form the anterior spinal artery. Posterior inferior cerebellar artery is given off in front of medulla but moving towards your cerebellum. Remember, this is a very, very tortuous artery. Although not seen well in the image, it is. Now you're seeing the anterior inferior cerebellar artery given off from the lower end of the basilar artery. These are pontine branches. I have pointed out to one, but there are many pontine arteries. This is superior cerebellar artery, again going towards the cerebellum, and this is the posterior cerebral artery. All these are arteries you should know. I'll tell you why. And here is an anterior choroid artery. I won't discuss details of it. It will be nice if you can read up further details beyond what I have taught you. Now let's understand how this image is relevant from our aim of understanding the brainstem. Okay, blood supply of brainstem. So now take a look. This is your medulla oblongata. So the blood supply to medulla oblongata is as follows. Vertebral arteries, anterior spinal artery and a posterior inferior cerebellar artery all give supply to medulla oblongata. Did you understand how the diagram works? I hope you did. Here is your pons. Use the same logic now. So the blood supply to pons comes from basilar artery and its branches, pontine arteries. Also there are other arteries which will help, but these are the main ones. So this is your midbrain and therefore gets its blood supply from posterior cerebral artery, and there will be again aid from other branches. So this image basically helps you to zoom in on the broad blood supply to parts of brainstem. For details, we will be going into the next section. Right. So broadly speaking, medulla supplied by vertebral artery, pons supplied by basilar artery, midbrain supplied by posterior cerebral artery. So you've got your, broadly speaking, you've got the arteries. Each artery now gives rise to 3 sets of blood vessels. This is conceptually very important. So if you feel yourself getting stressed, go back, revise and come back to this section. Each artery gives rise to 3 sets of blood vessels. Close to the midline, sagittal plane, they are paramedian branches. On the anterior and anterolateral side, they are short circumferential branches. On the dorsal and posterolateral side, they are long circumferential branches. Too much? Yeah. So we'll take a look at an image to understand. Right. So this is a section, say through medulla. These are paramedian branches. Can you see how they are supplying the medulla on either side of midline? These are short circumferential branches supplying the anterior and anterolateral part. These are long circumferential branches. So this is how these arteries go on to supply sections of medulla. Paramedian, anterolateral, posterolateral. Paramedian branches, short circumferential branches, long circumferential branches. Okay. With this basic, let's come to blood supply of medulla oblongata. So here you are seeing a section of medulla. The median zone is supplied by anterior spinal artery. This is the median zone supplied by anterior spinal artery. Lateral zone supplied by vertebral artery. Posterior zone supplied by posterior inferior cerebral artery and posterior spinal artery. Let's revise this once. So this is a section through the medulla oblongata. Now you know that the median zone is supplied by anterior spinal artery, the lateral zone by direct branches from vertebral artery and posterior inferior cerebral artery, and the posterior zone is supplied by the posterior spinal artery. Similarly, let's study the blood supply of pons. Blood supply of pons is again divided into anteromedian zone, lateral zone and the posterior zone. Anteromedian zone, paramedian branches of pontine arteries. Lateral zone, short circumferential. Posterior zone, long circumferential. At this moment, that's all I want. There's a lot of theory, but I don't want to know it. Let's go to the diagram and understand. This is a section through the pons. The basilar artery goes on to supply. This is the basilar artery giving rise to pontine arteries. So, the anteromedian zone is supplied by branches of basilar artery. The lateral zone by short circumferential branches of pontine artery. The posterior zone by long circumferential branches of pontine artery. along with support by anterior inferior cerebellar and superior cerebellar arteries. Have you got this? I hope so. So the basilar artery, which is present in the center, gives rise to short branches that supply the anteromedian zone. Pontine arteries, which are running along the surface, give rise to short circumferential branches that supply the lateral zone. And the posterior inferior cerebellar supplies the long circumferential branches, along with help by superior cerebellar and anterior inferior cerebellar artery. So midbrain. Midbrain again, similarly anteromedian zone, lateral zone and posterior zone. Take a look at the branches here. This is midbrain. This is the basilar artery, posterior cerebral artery. So this basilar artery will supply the paramedian zone. Short circumferential branches and long circumferential branches supply the rest of medulla oblongata, rest of midbrain, along with help by superior cerebellar, posterior communicating and anterior choroidal arteries. Now, I don't say that you have to know all of this. You have to keep this in mind when we go for a detailed discussion about medulla, pons, midbrain. This should be there with you. You can come back to this lecture for referring. Okay. So what did we learn today? We answered some very basic questions today. What is brainstem? Where is brainstem? What are the parts of brainstem? What does brainstem do? Then we began the basic anatomy of brainstem, relations and cavities of brainstem, and the flow of CSF. Then we talked about cranial nerve attachment, and finally we talked about the blood supply of brainstem. This is an initial introduction to brainstem. Feels a little heavy for all of you, but revise it a couple of times. Confidently go towards the question section, solve the question section, and then I'll see you in my next lecture where we will be developing the brain. It's going to be fun. See you across the screen in my next lecture. Bye.